Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Living Kidney Donation, a guide for kidney recipients and potential living donors. Introduction. Kidney transplants have helped thousands of people with kidney failure enjoy longer and healthier lives, free of the restrictions of dialysis. Kidney transplants are very successful, with more than 95% of kidney transplants still working after 1 year. Transplants generally last 10 to 20 years depending on the type of transplant a patient gets. Kidneys for transplant may come from a healthy living person like a family member or a friend who offers to donate a kidney, a living donor, or from an organ donor who has died, a deceased donor. Donating a kidney is an act of generosity. In the United States, it is illegal for anyone to sell their organs. Both kidney patients and potential living donors have questions about living donation. This living donation program discusses its advantages, the evaluation, surgery, and recovery process of the donor, the risks of donation, and common concerns donors and recipients have about living donation. Advantages of transplant and living donation. Dialysis is a life-saving treatment for patients with kidney disease. However, dialysis can only do 10 to 15% of the work of a functioning kidney, since most dialysis types do not happen for 24 hours a day. Someone with one working kidney has 50 to 85% of normal kidney function. Compared to patients on dialysis, transplant patients generally live longer. Transplant patients are more likely to report having more time to do what they enjoy, including freedom to work and travel, because they do not have to undergo regular dialysis treatments. Living donor transplants generally last longer than deceased donor transplants. Living donor kidneys generally last 15 to 20 years, while deceased donor transplants usually last 10 to 15 years. There are several reasons why living donor kidneys work better and last longer. The healthcare team tests each potential living donor in advance to find the most suitable match. A living donor kidney has a better chance of working normally right away because it does not spend much time outside of the body. Living donor transplants can also happen faster, often within 1 year, because the patient does not have to wait for someone to die and donate their kidney. Patients wait for a deceased donor kidney for 2 to 6 years on average, depending on where they live. Eligibility. Not all people qualify as a living kidney donor. A living donor must be willing to donate, have a blood type that is compatible with the recipient's blood type, not have diabetes or high blood pressure, be absolutely healthy. Because living donors are healthy volunteers, doctors want to do everything they can to protect donors' health and kidney function. A living donor will not be able to donate if he or she has a serious medical problem or any condition that affects the kidneys, such as high blood pressure or diabetes. Although many people think so, living donors do not have to be blood relatives or even of the same race as their recipients. Many successful transplants have occurred between husbands and wives and friends who are of different races. Each transplant center has its own policies about whether individuals who are older, smokers, or overweight can donate a kidney. Interested individuals should call a transplant center to discuss whether they are living donor candidates. During donor evaluation, the medical team compares the blood of the potential donor and recipient to make sure there is a match. Then, doctors check the potential donor's blood pressure, heart rate, and lung function. They also take blood and urine samples and check the donor's kidney function. Sometimes friends or family members want to donate, but they aren't a good match for their loved one. With kidney paired donation, 2 or more medically suitable donors each give a kidney to someone else's loved one. This way, each kidney patient receives a donor kidney that is a good match. Evaluation can take between 2 to 6 months. If there is any medical or psychological reason why the donation should not happen, the transplant team will stop the transplant. If a kidney patient does not have a matching living donor, the transplant team will place the patient on a national computer list to wait for a deceased donor kidney. The kidney patient can also go on dialysis. The following sections describe what a living donor can expect during and after surgery. The tutorial also discusses other non-surgical concerns that donors may have. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Surgery. Surgery to remove a kidney is called a nephrectomy. A donor must sign a consent form before having this surgery to assure that he or she knows what the surgery is for, understands what the risks are, and will allow the doctors and other hospital staff to proceed with the surgery. The nephrectomy is done under general anesthesia. The procedure usually takes 2 to 4 hours. The donor and the recipient are operated on at the same time, usually side by side in different rooms. One team of surgeons performs the nephrectomy, that is, the removal of the donor's kidney, while another prepares the recipient for placement of the donated kidney. There are several surgical techniques to remove a living donor's kidney. Doctors perform either an open nephrectomy or a laparoscopic nephrectomy. In open nephrectomy, the surgeon makes a large incision along the donor's side or abdomen. Some surgeons do a mini-nephrectomy, which is an open nephrectomy with a smaller incision. In a laparoscopic nephrectomy, the surgeon uses video technology to remove the kidney by making several small incisions on the lower abdomen. The advantage of laparoscopic surgery over the standard operation is that donors tend to have less pain, a smaller scar, a shorter hospital stay, and a faster recovery. After the donor's kidney is removed, it is given to the recipient's surgical team, who immediately connects the kidney into the recipient's body. The surgeon then closes the donor's incision. For most living donor transplants, the donated kidney will begin working right away, while the recipient is still on the operating table. Sometimes the kidney has delayed graft function, where it does not work for a few weeks or months. Sometimes the kidney does not work at all. If the kidney does not work, the kidney recipient can go on dialysis or pursue getting another transplant. As with any major surgery, donors will feel sore and groggy when they wake up. Most donors spend 1 to 3 days in the hospital following the operation. While the donor recovers from surgery, he or she will take pain medication. After leaving the hospital, a donor gradually returns to their usual activities as the body recuperates. Typically, donors return to work 2 to 6 weeks after surgery. With a physically demanding job, a donor might need more time to recover before returning to work. After fully recovering, donors should be able to do just about everything they did before donating. It is best to avoid activities that could cause direct injury to the remaining kidney, such as football, hockey, and karate. Also, military services and some police and fire departments do not accept individuals who have one kidney. Risks and complications. There are several possible risks and complications involved in donating a kidney. Even though they are unlikely, the donor needs to know about them before deciding to donate a kidney. Risks associated with having anesthesia include the possibility of vomiting or chipped teeth. In very rare cases, anesthesia can also cause strokes, heart attacks, and pneumonia. To prevent these, the anesthesiologist will review what medications the patient is taking beforehand. After the surgery, the donor will be asked to cough and breathe deeply to prevent pneumonia. Blood clots can occur in the legs due to inactivity during and after surgery. Blood clots can dislodge from the leg and go to the lungs, where they will cause shortness of breath, chest pain, and possibly death. Getting out of bed after surgery can help decrease the risk of blood clots in the legs. Other risks are seen in any type of surgery. These include an infection that may require long-term antibiotics and possibly another surgery. Bleeding, either during or after the operation. This may require a blood transfusion or another operation. A scar. There are some risks and complications related specifically to donating a kidney. These again are very rare. However, it is important to know about them. If the doctor is using laparoscopic nephrectomy, he or she may need to shift to an open nephrectomy during the operation. This could make the scar larger. Structures in the abdomen could be damaged. A donor may need another operation to repair this damage. Death during donation surgery is extremely unlikely, but it is possible. Studies estimate 3 deaths out of every 10,000 nephrectomy procedures. After donating, living donors may have a slightly increased risk of high blood pressure since they only have one kidney. Kidney donation does not appear to increase the chance that the donor will develop kidney disease or kidney failure. However, some donors have lost the use of their remaining kidney immediately or after many years. Because of their charitable acts, UNOS has established a policy whereby living donors receive top priority on the waiting list to receive a transplant. Other concerns. In addition to surgical concerns, there are other concerns about living donation that people have raised. A person may not understand why a living donor would want to go through donation surgery. Living donors regularly say that they want to donate because they care about the kidney patient and want to do something to help. Most donors say that seeing their recipients' improved health after transplant more than outweighs the pain and inconvenience of donating. Donors will also enjoy spending time with the kidney recipient for years to come, thanks to the health benefits of living donor transplant. A person may be concerned that a living donor would be pressured into donating. A living donor must be a willing volunteer. Kidney patients must give each potential volunteer the freedom to choose whether to be a living donor. The transplant center uses an independent medical team, including a therapist, to evaluate donors to ensure that they will not be medically harmed or pressured into donating. Donors can also stop the transplant at any point, even on the day of surgery if they change their mind. A person may be concerned about the costs of donating a kidney. Donors are not responsible for the medical costs of the evaluation, surgery, or hospitalization. These costs are covered by Medicare and/or the recipient's insurance. However, they may lose wages when they take time off work to donate or have childcare, travel, or lodging costs associated with donating. The donor may use vacation leave, sick leave, or short-term disability insurance to cover the costs of kidney donation. A potential donor may have concerns about being turned down for health insurance, life insurance, or disability insurance if he or she donates. Although it is very unusual for a kidney donor to be turned down for insurance, this has happened. Donors should talk to a financial counselor at the transplant center and their insurance company before donating. A woman might be concerned that she won't be able to have children after donating. Many living donors have had children after donating. Doctors recommend that women wait 1 year before getting pregnant to give the body plenty of time to heal. Donors who become pregnant should make sure their obstetrician or gynecologist knows they donated a kidney. Some people are concerned that their religion might not support donation. Almost all religious denominations approve of organ and tissue donation as representing the highest humanitarian ideals and the ultimate charitable act. Potential donors should talk to their religious leaders to find out how their specific religion views organ donation. If you like this video, please like and share. For similar videos, subscribe to our channel. Deciding what to do. Kidney patients can get the word out that they are interested in living donor transplant in many ways. Some talk about their kidney disease generally and wait for living donor volunteers to offer. Some send emails to ask people to learn more about living donation. Some have family meetings to talk about living donation. Some have family members and friends help get the word out for them. Many times, family members and friends learn about living donation on their own. When deciding whether to donate, individuals can call the transplant center to ask questions. Information discussed with a transplant team is not shared with the kidney patient. Individuals who decide to be evaluated must let the kidney recipient know and call the transplant center to begin evaluation. It is normal for kidney patients and their family and friends to have a lot of questions about living donation. Both kidney patients and potential living donors must make the decision that is right for them. The transplant team will respect and support whatever decision they make. Thank you for using Explain.